We're very delighted to have Dr. Wenhui Laura Lee. She's the founder of Help Undiagnosed Children Foundation. And today she'll be talking about solving the negative cases, ending the diagnostic Odysseys through genomic data reanalysis. So I'm going to hand over to Dr. Lee, and she can give you more information about herself and her presentation. Thank you, Dr. Lee.
Thank you. So I'm going to share my slide. Hi, good morning, everyone. And I'm very happy to come here to give a talk. And hi, good morning. My name is Laura Lee. And so I'm the founder for Help Undiagnosed Children Foundation. And I used to work at Children's Hospital, Los Angeles, the biggest children's hospital on the West Coast in US. And I have seen a lot of like families and kids. The kids have like genetic diseases, and but they are like due to the due to their economic situation, they could not get the genetic testing, or they have insurance. The insurance will not pay for the genetic testing. So I founded the foundation, Help Undiagnosed Children Foundation, just in case they need help. And so we will step up and to help them to do the genetic testing, so they can have the diagnosis and to enable the doctors to give them the proper treatment. And like right now we're helping the kids or families who need that help, and to offer the free like genetic testing. And also I understand that there are a lot of kids who have a genetic disease. They have done the like a whole exome, whole genome sequencing, or gene panel sequencing. But the diagnostic yield for that kind of testing is still 40 to 50%. So that leaves like 50% to 60% of the families. Although after the genetic testing, they still don't have the diagnosis. So here we come in to help and to help the family. So if they have the genomic data, they can submit the data to us, and we can help them to do the reanalysis. So why you want to do the reanalysis like with us is because we partner with Breakthrough Genomics, and Breakthrough Genomics has these AI tools and to really help the improve the diagnostic yield. And so we partner with Breakthrough Genomics, which has a founder from Children's Hospital Los Angeles, and also from Illumina and from Google. And so they come out with the AI tools to help the undiagnosed children to find the diagnosis. So here's the third-party study carried out by the British Columbia Children's Hospital. And so they evaluate these tools and to see like if these AI tools can help them to find the diagnosis. So here they have the two cohort. One's the research cohort, has 532 patients, and also they have a clinical cohort, has 71 undiagnosed patients. So the purpose of this study is they want to see if they can use the AI tool to do the reanalysis of the genomic data, and they want to see like if the internal intermediate internal like reanalysis can resolve the unsolved cases, and also this AI tool can help to identify the missed diagnosis. And if there's a missed diagnosis, what the factors leads to this missed diagnosis. So the study they have, so the study they have done is they have a 269 diagnosed cases, and they run through the three like software platform. And so here they just want to validate this AI tool can find the like already diagnosed cases. So they have run the cases through the software platform, and they found the AI tools called virtual geneticists can find the diagnosis in the top 10 like a variant list at 99% of the time. And also find the diagnostic variants around 80% as a top one like a variant, and compare with other non-AI tools, as you can see here. If you just look at the top one like a variant that listed by the diagnostic platform, and if you use like the Axomizer or Lyrical, you're going to miss around like 50% of the diagnosis. And if you look at the top 10 like diagnostic variants, and so in like these two platforms will miss like around 20%. And if you use the AI tools here, like a virtual geneticists, and you only miss 1% of the diagnosis. And so there's a big difference that what tool you use to do the diagnosis. And so like a British Columbia Children's Hospital, they presented this study at the American Society of Human Genetics conference in 2023, and showed that using the AI tool, the virtual geneticists, can really help them to find the diagnosis. And as you can see here, so they actually for the research cohort, 253 cases, and for the clinical cohort, which have 71 undiagnosed cases, and they use the AI tools. They actually can find additional like diagnosis, 10% like additional diagnosis in the clinical cohort, and also they can find 8% of the like additional diagnosis in the research cohort. So these we're talking about like all these testing that miss the diagnosis. They actually they're they missed by all these U.S. CAP clear certified lab, including Embry Genetics, Prevention Genetics, and Inviti. And so you would expect that these famous like U.S. CAP clear like certified lab, they're actually have the best has the best diagnostic yield that you can expect, but how they can miss the diagnosis. So there are several reasons how they miss the diagnosis, and first one is a gene phenotype bias. So it's a complicated like in genetics like sometimes one gene can cause like several phenotypes, and also one phenotype can be caused by several genes, and so that is almost like a matrix, the genetic cause and the phenotypes, and they're like a matrix, and you actually is very complicated to find that diagnosis. And also the most majority of the mis like diagnosis is a blended phenotypes and the dual genetic diagnosis, or the phenotype expansion. So for example, there are cases like the most difficult cases. They actually they have like a two genetic two genes are mutated, so we call it dual genetic diagnosis. So that means because there's a two gene like mutated, then these each gene has a set of like a phenotype phenotypic representation shown in patients. So when you have a two gene like mutated, so there's a mix of the phenotypes. So it's hard for a doctor or geneticist to pinpoint these group of like phenotypes. In fact, pinpoint to the back to the gene cause. And so dual diagnosis is the majority miss the diagnosis by these US CAP clear certified labs. And because they do the manual curation, and these dual diagnosis can be easily missed by the human. And with the AI tools, and the AI tools can efficiently pull these dual diagnosis out and to give the diagnosis for the patients. So the example is we actually have done the study with a combined brain, and so they basically studied childhood neurological patients, and so they use two software platform. One software platform they don't have the AI, and the other software platform is a virtual geneticist with AI. And as you can see, with the software platform on the diagnosis with a competitor app, and so these platform missed 4 out of 6 diagnosis, and while the virtual geneticists identify these 4 cases right on the spot. So that's the tools we're going to use. So for our patients and the families, if they have the genomic data, it doesn't matter it's a whole exome sequencing, whole genome sequencing, or gene panel sequencing data, and if it is the patient's or family's right to get this data from the clinical lab, and then you can submit the data to us, and then we can use this virtual genetics platform to upload this data and do the diagnosis for you. And so we expect around 10% diagnosis, additional diagnosis for the undiagnosed patients. So we actually using these AI tools, we're able to find the diagnosis that previously missed by other labs. And so Rachel is our is my partner, and she's managing the family cases and the patient cases, and so she can talk about 2 cases that as an example that we have helped. So Rachel, you want to talk about the?
Yeah. Okay. Thank you. As Dr. Lee said, the Help Undiagnosed Children Foundation, it's to help sick children in medical and financial need to really receive the most comprehensive and cutting-edge genetic testing, either at no cost or even at a reduced cost in some situations, so that we are really helping kids to get a correct medical diagnosis so they really can lead their most fulfilling lives. This makes all the difference if this can be done when the child is growing up. So as a basic overview, HUCF is a 501c3 nonprofit organization. We help newborns to young adults through age 21. We help families with sick children throughout the United States. Our website is hucf.org, and the contact is info@hucf.org. And let me go to the next slide, and I'll also talk a little bit more. What we do is basically we do 3 types of genetic testing that we can offer, and then plus our new program for the reanalysis. HUCF is able to offer whole exome sequencing, whole genome sequencing, and BGE, which is a blended exome genome sequencing. And we're so excited to have this new tool. We have named it our Whole Resolved program. This is because we get outreach from families, and this fills a very specific need. Had the little Adrena's family called earlier in the year. She had a whole exome sequencing, and they found a rare variant, and the family wanted a second opinion. They wanted to be sure of what this meant for the diagnosis, and weren't able to get retesting done with the current doctor. They were very frustrated. So when they reached out to us and we looked at their situation, they weren't even in financial need. They were willing to pay for, us to, have a different lab do the testing just so that they could be sure of what the results were. But when I talked to Dr. Lee about the situation and the fact that they already had a whole exome sequencing, instead of having the parents and grandparents pay for another genetic test, we suggested to them to use the virtual geneticist to have the reanalysis done. They readily agreed to that. They had already changed doctors for their child, and they agreed to that. And we worked with them to get the raw sequencing data from the lab that they had used so that we could do the reanalysis. And the upshot was that we were actually, in fact, able to confirm the rare variant that was already identified. In addition to that, the reanalysis showed that there was another pathogenic variant there. And there was also one of unknown origin, even though I didn't put that on the slide. So then in talks with the family and with the family's doctor, Dr. Lee was able to answer questions about the variants identified. And the doctor and the family were very appreciative of having this reconfirmed and having the additional variants found while she's still 4 years old. So this certainly gives the doctor more to look at as she grows up. And I just had to include the quote from Audrina's mother. This is why we're here. We're here to help the patients. That can be in different ways, but I have just gotten another referral because HUCF is also a member of NSSN. So I was very glad to see that Cure is as well. I just received another referral through NSSN for another family, mother with 3 children. One of them has a rare disease, have had first genetic test. No answers she felt were really available. So it was the same situation. She wanted someone else to look at it. She wanted a second opinion. So we're in the process of working with her to get started with the reanalysis. She, said, this sounds, fabulous. So we're working with her now on that. But we've also worked with other families where one child had one variant in neurofibromatosis, the other child had another one, and worked with the parents. So, for example, that family has a much better path forward for their kids and their whole family. So I really wanted to talk about specifically Audrina because this is the face of what the reanalysis can mean for a family. And she's 4 years old, and it's going to help her throughout her life. So